talking about some of the things that you need to know as an individual, especially when you have to interact with your doctor. Just looking at these very common areas. So, welcome to the live. Let me know where you are watching from. Let me know who is joining in. Okay, sometimes people really do not take advantage of the time that they have to spend interacting with their doctor. And if you really want to get the best from any consultation with a doctor, then you should be well informed. You should know what to do. You should actually know what is expected of you as an individual, as a patient. So, just that need to understand that you must get value for the time that you are going to spend in a doctor's office, a consulting room. Okay, so it's important to have that understanding and the intention. So you need to be intentional about what the outcome is going to be when it comes to interacting with your doctor. Okay, so people don't just go to the uh, hospital or the clinic for a visit. When I mean visits, just to show face. Okay. Okay, so people go um, on purpose. There's usually something to talk about. Some of those things may not be important to other people, but they are important to you as an individual. So once you know that that's important, then you should be maximizing the time that you are spending with your doctor. Right, so welcome to this live. It's just going to be a very brief one. All right, so understanding that it's about communication, and communication is key and essential aspect of achieving the purpose for which you are getting involved in consultation, for example. All right. As I said, some people may not see the need or the essence of you consulting with a doctor. Okay, but you know why. In fact, sometimes we have seen patients who have had some complaints that have lasted years, and then people try to tell them, don't worry, there's really nothing about this. And then maybe they try some home remedies, natural, traditional methods of treatment, and then maybe over-the-counter medications. Okay, but sometimes you now find out such an individual probably coming in with some complications. Okay, so you should be confident in your purpose or intention to see a doctor. You should know that whatever complaint that you have, there's no complaint that is too small, and there's no complaint that is too big. So you must understand that. Okay, and it's always good to catch things early and deal with those things that need to be dealt with. All right. So communication is very important. So you must have your reasons, you must have your questions. Interestingly, I enjoy patients or clients who already have a list of questions that they want to ask or the complaints that they want to give. Okay, that saves a lot of time, so we can go straight to the specific areas. Please let me know if you can hear me. Let me know if you can hear me. Welcome to the live. Kindly confirm that you can hear me. I hope I'm audible. I'm using the Bluetooth device. Let me know if I'm audible. Thank you for joining me. All right, so I'm talking about the things that you need to know as an individual when it comes to interacting with your doctor or any healthcare professional. All right, so you must not feel that you're asking too much. You must not feel that your doctor may see you as a burden. Okay, and that's very important. That fear, that lack of confidence or understanding the reason for interacting, for the interaction between you and your doctor may cause some gaps when it comes to managing your health, and you must be sure that you are not sort of changing yourself. You must be sure that you are not cheating yourself. You must be sure that sometimes, in fact, some people uh, do not. Some people pay out of pocket. Some others, of course, under insurance and all. But the point is that somebody somewhere is paying for the services when it comes to consultation. Even if you're having a free consultation, somebody is paying, whether it's your doctor, someone is paying. Okay, so now maximizing the time interaction is very important. Okay, so don't see your interaction with your doctor as something that you should be scared of. It's not an interview. Sometimes I interact with people and I make it look like this is an interview, okay? But really, the communication is to help to search out the things that need to be searched out, the things that need to be identified when it comes to your health. All right. So asking those questions, but that's actually the pattern. I mean, talking about starting even from medical school, we talk about history taking. So we want to ask questions that some of the things that you don't even think are important. Your doctor may ask questions relating to those areas. Okay, so but if you already come with questions, a list of questions, concerns, it becomes more interesting. Of course, there are some people that we call difficult patients. Okay, some people may just keep coming and then just coming with different complaints to the hospital and checking it. They do not really have any serious condition that needs to be treated, so to say. But even their psychological state itself may need attention. All right, so um, you should be free. For example, for people who are being managed for hypertension, if you there are some very common questions that people ask or some statements that people make that I try to we try as doctors to clarify. Okay, thank you for the likes. Thank you for the likes. I really appreciate it. Good morning from this side. Okay, let me know in the chat if you can hear me clearly, and if you are finding this interesting, let me know in the chat. All right, so talking about the fact that people don't see any need to maximize that time, but questions are common for people that usually ask or make statements. So some people make statements like, okay, if somebody is taking medications for hypertension, okay, sometimes I've seen patients come into the consulting room and say, oh, doctor, I've not taken my medications this morning because I have not eaten. Interestingly, it's a very common statement that I hear from patients. Oh, okay. Tosin, listen me. Please, are you male or female? Tosin, listen me. Welcome. Thank you for tuning in. Saying hi. Hello, Tosin. Tosin, are you from Nigeria? Yes, I'm from Nigeria. Thank you. Doing this live from Lagos, Nigeria. So thank you, Tosin, saying hello. Hello, welcome to the community. Thank you for joining this live. Okay, kindly just get connected. I mean, follow, subscribe to the channel. I'm sure you can find several interesting, highly informational, educational videos on health, and that's what we do majorly here. We talk about our health matters. I'm a medical doctor, a family physician by God's grace, and I have been on YouTube for about 4 years now. Okay, and it keeps getting interesting that a lot of people are getting blessed from the information that I share, and I appreciate the feedback, the likes, the comments, the shares. I may not really have time to let you see many times, how at the back end, quite a number of people getting to do so much in terms of supporting the channel. Okay, so I do not take this for granted. All right, so I keep trying to do more. Okay, in spite of my very busy schedule. Okay, so Tosin Lesomi says, "How are you? I'm doing great. Good to know that you're also from Lagos. I can see that you said somewhere that you also are you okay? Maybe you delete that. Okay, say you too. Yes, you're also from Nigeria. So good to have you here. Okay. So I may not be able to give all the details of my workplace. Okay, but of course you can check my mail. In fact, we have a WhatsApp group that you can check the profile on my profile, and then from there we can get to know more. Thank you, Mr. Tosin. It's a public space. Of course, there's nothing hidden anywhere. You can even search and you may find information about me. But I operate on a global level. As I do this public education, I offer virtual consultations. I do public speaking. I get invitations for medical outreaches. So I'm also into research, education, academic aspects of medicine. So there's a lot that I'm doing. Those listen me. I like your questions. Okay, are you rich? I'm so wealthy. I'm a Christian and I'm a child of God. I'm so wealthy. Wealthy in terms of the spiritual substance that I have by God's grace. I'm born again. I know understand things about the Bible a little, and that gives me some confidence. Knowing God, I mean, that's where my peace really is. Knowing God, having confidence that God is with me, and all. So that's where the confidence is. Not in money. Money is important, definitely. Okay, and of course, talking about our health. Health is not just about our body. It's about our spiritual state, your soul, even about your mind, your intellect, and your ability to process information, your relational abilities, relationships. These are very important aspects. Then we talk about the physical, the body. Okay, so that's what we look at generally in this place, and I'm sure you will be finding this community interesting. Thank you. To sign Ilesami, saying God bless you. Thank you so much. God bless you too. Okay, it's okay. Thank you for showing up. Thank you for coming in. All right, so I was talking about the need to maximize the time that you spend. So when people, for example, someone says, "Oh, I've not taken my medications because I've not eaten." The fact is that there are some medications that do not require food before taking them. So you need to have this clarity or clarification from your doctor and from your pharmacist. Okay, because the doctor may not give all the details in the prescription. Okay, but the pharmacist, because it's teamwork, so the pharmacist should help you to understand how to take your medications. Interestingly, there are leaflets in some of these drugs that you can read to help you, but you should always follow your doctor's prescription as much as possible once you don't react to medication. So for people who take medications for blood pressure, the fact is that many of those medications do not need food for them to work. So somebody who is having high levels, uncontrolled blood pressure, stroke as a complication will not wait for the person to eat before it happens. Okay, kidney failure, heart attack, they don't actually need food before they happen. Okay, whether the person is eating or not eating, but the fact is that once the blood pressure is not controlled, whether the person had eaten, had not eaten, the person took their drugs or didn't take their drug, okay, complication can come up. All right, but for most people that develop complications, there are people who are either skipping their medications. So I don't know if you have relatives like that. You have someone you know who is a known hypertensive, but somehow they're not regular with their medications. So such a person will not have their blood pressure well controlled. So you need to see how you can support such an individual, and you may be here. Oh, B and B with quick. I'm so sorry, so engrossed with my talk. Oh, build and brand with quick. Good morning, doctor. Yes, good morning. Thank you for joining this session. Happy weekend. Yes, happy weekend to you. Thank you. So sorry. Apologies. I, I'm talking to you now. So, how's your weekend going? Quick. Good to have you here. Thank you. Please, can you hear me clearly? Let me know. I'm not sure how audible this Bluetooth device is for this live. Is it clear? Is the audio clear for you? Let me know. So how are things going? How is work? How are you doing with your work and business? How is the family? Okay, build and brand with quick. I'm talking to you now. Okay. So, welcome everyone joining in. It's good to have you here. Happy weekend from this side. Just a few minutes of clarifying some important things that you and I need to know or be reminded of, even regarding health. Okay, so I've talked about the need to be regular with medications. So it's always good to follow prescriptions, and that goes a long way to help. Okay. Some people it's just a day or two of skipping or missing their medications, antihypertensive, that they begin to come up with complications. So you need to be sure that you are doing the needful when it comes to taking your medications. And then some people say they decided not to use their medications because they were coming to the hospital. Okay, as long as there was no instruction prior to your appointments with your doctor not to use your medications, you should use your medications. I mean, as already prescribed. So your appointment with your doctor does not cancel uh, your your prescription, the dosing of your medications. Okay. So Asen, welcome. Asen, hope you can help us with interpretation. So where are you watching from, Asen? All right. So it's always good to put that in mind that your appointment with your doctor does not cancel uh, the plan that was originally in place for your management. Okay, because like I said, people get to develop stroke and other complications because they fail to do the needful when it comes to taking their medications. Okay. All right, so we're going to continue from here next time. We'll continue from here next time. I mean, possibly before the end of today, we should talk more about these things. So, thank you for joining in. Thank you for tuning in. It was nice having you here. See you again soon. Bye for now.